about the numbers of what you expect as far as surgery volume for like heart cath and open heart and what you have now? Just give some background on what you're...
In terms of what we think is going to shift? Well, we're going to continue to do such a great job that Mike's going to be asking us for cases. It's hard to predict. We figure that between Palmetto and in our program, that probably about 20% of patients come from Lexington County, somewhere in there, 20–25%. How those move over time, how physicians respond to another program is really something we don't have a good fix on. We're not spending a lot of time worrying about it. The appropriate incrementalization and development of services happen for the right reasons. You can't force those things to happen, and in my experience, if it's done thoughtfully and in an organized fashion, you don't have this huge void overnight. And it'll balance itself based on what the community wants and how the physician community thinks the needs of their patients are going to be served.
How did you reach the $15 million figure?
The number was based on the reality that there was some loss of income that would happen to Providence hospitals, and some compensation for that. We had big numbers. There were other numbers on Lexington's, and the final number was a negotiated number that two fair-minded organizations came up with, and we think it's a number that we can live with, and we hope that Lexington is happy with the number as well.
You're going to use some or all of that money for other additional health services you plan. Could you be specific about that?
We're a Sisters of Charity of St. Augustine organization. All of our dollars go back into our care and delivery systems, as Lexington's does as well. So we'll be plowing every dollar that we can make and are awarded through this agreement right back into continuing to improve our heart programs, continuing to improve our general services, and helping with our Northeast expansion that we now can move forward with. We'll need that and a lot more to do what we have in mind. But thank you.
What does this let you do there that you were held up on before?
So we need to expand our inpatient bed tower. Our emergency room is woefully inadequate to deal with the volume that's going through structurally. We've got clinical platforms and other areas that need expansion. As you know, the Northeast over the last 5 years has grown substantially, and we've really been constrained to expand that. Since the original certificate of need application, there are lots of factors in the marketplace that have changed, and we've been analyzing and looking at that. But by and large, it's retrofitting the physical plant to deal with the population growth, and it is not adequate to deal with that at this time.
What's the timeline on dropping the lawsuit? What do you have to do to make that happen?
That's already happened.
That's done?
That is done. As far as the timing of the certificate of need process, we would expect to submit a certificate of need application sometime maybe around the late summer. The process requires a very lengthy application that's probably 4 or 5 inches thick, so it'll take our staff some time to put that together. Depending upon whether or not there's opposition to our project, and it's our joint project, the process could take 6 to 9 months. And then as far as getting the program finally organized and pulled together, it's possible that we could begin serving patients as early as late 2010. And there are a lot of things that could change that, but that's probably a best case scenario.
Talk about the culture change that had to take place to get this done. These hospitals and these organizations didn't really, is it fair to say, didn't even really have diplomatic relations? I mean, this is a long legal fight. Talk about what happened to get you all to stay.
Yeah, we had a Helsinki meeting. And, well, there were meetings between the CEOs. There have been discussions in the past, but looking back to January 2008 is when this discussion really got off the ground. Michael and I didn't know each other prior to that date, and I don't think Michael knew our past chairman at that time either. And the three of us agreed that it was important that the board members start getting to know each other and starting to talk about some of these issues. And so, Michael and I had developed a friendship. The conversation continued over the past year, oftentimes after hours on cell phones, just many different conversations. I can't tell you the number of times we walked up and down the street to each other's offices to sit down and meet with each other face to face. So beyond the formal mediation, there was a good bit of time spent either on the telephone or meeting face to face, trying to work through these issues. But it's encouraging to go through this process and to see it come to a result where you have an agreement and you have the opportunity to continue working together going forward. And if issues come up in the future, there'll be, and there may be, I know I can pick up the phone and call Michael. Whoever succeeds me will have the opportunity with their the new chairman at Providence, whatever Michael decides his pay isn't high enough as a volunteer. So, but we think this is a real opportunity, and the door's been open for continued discussions.
I'd like to add what Thad said. A former board chairman here at Lexington, Bill Stillwell, encouraged me to move forward with the process and gave real assistance to those early stage meetings more than a year ago. I came over here and Mike Biederger gave me a tour of this beautiful campus and the beautiful hospital that you have here. And a delegation came over to Providence and saw wonderful hard work being done, and were educated and appreciated what we were doing. So really it was the typical things that you do in building a relationship. You try to understand each other, you understand each other's strengths, needs, and concerns, and you start negotiating from that standpoint. And we had lots of encouragement along the way. And then Thad comes on the scene and is a realist and is anxious to do the best for the community that he serves, and we're here today.